There for Care is brought to you by CareScout with the goal of sharing real-life conversations about aging care. Views expressed on this program are the speaker's own. We do not provide medical, legal, tax, financial, or other professional advice. Always talk to your own professional advisors for advice tailored to your needs.
Long-term care isn't about being comfortable in retirement. It's about protecting your family members and those relationships and that legacy that we have. There was no dialogue. There was no language for caregiving and what it took and how complex it was. When I pivoted my career from aerospace into the healthcare industry, I developed my background in genetics and AI since I knew that was the future of big data. I interviewed hundreds of other family members, and I wanted to understand what was the core DNA of devastation that was experienced on this topic that we wanted to get rid of. That was a core problem we wanted to solve.
What do you hope people talk about that maybe you didn't talk about with your family that resulted in your experience?
Is it possible for us to motivate young enough family members to think about this topic, to build out that care plan so that they could actually afford a much better quality of life when they need it, when they age?
Welcome to the There for Care podcast by CareScout, a podcast about all things aging care, whether you're navigating the journey for yourself or your loved one. I'm Amy Rein, and today we're talking with Lily Vittayarukskul, who is the CEO and founder of Waterlily, which is a company that's using AI to project long-term care needs to help people plan better and have better conversations with their loved ones. She brings a very unique personal caregiving story to her founder story. So with that, welcome, Lily. Thank you for joining us.
It's a pleasure to be here.
Yeah. So let's start at the beginning. So you came to caregiving very early in life. So just tell us a little bit about that.
Yeah, I never expected it. I think there's most of us that have a really compelling caregiving story, usually when we're in our 40s or 60s, taking care of our aging parents. And I would say the unfortunate reality where it hits you sometimes sooner than expected. So, for me, it was when I was 16. My aunt was diagnosed with terminal stage colon cancer. And what came with that was 2.5 years of navigating her daily long-term care needs, such as getting in and out of the bed, taking a shower, using the bathroom, etc. And we took on all this work and it mattered so much to us because she was essentially like my second mom. She helped raise me under the same roof growing up. As a part of our first generation immigrant family. And I never thought I would get into the healthcare space before this. If anything, I'm very much a zeros and ones sort of person. I know that many folks have told me growing up, I don't look like a zeros and ones sort of person. But from 12 to 16, I was fascinated by aerospace, was doing some work with NASA, won national competitions, and got a wonderful chance to do a robotics internship at NASA's robotics section, Jet Propulsion Laboratory in Pasadena. And it was a dream sort of situation for me. Of course, we couldn't afford college. At least I had to pay for my own college. And so I went to college at 14 because it was financially a lot more affordable for me to do that at a much younger age instead of your normal admission process. So I first wanted to kick off my career, but also at the same time, it was very apparent to me just the financial realities of just living and what goes into it and what goes into taking care of a loved one. And so in a long story short, when I was 16 going through this internship, when we navigated this care for my aunt, it was incredibly devastating for us. It was a huge eye-opener. And I'm sure that there's many listeners to this podcast where they'll tell you it just hits you out of left field. When she got the diagnosis, she became frail, started needing help with these basic daily tasks, meaning she needed help essentially around the clock. We took on majority of that care ourselves, especially my mom. My mom was a primary caregiver and she did anything and everything for her. And at the same time, she was still running our small family business. And I stepped in more for that small family business because my aunt was a core part of that business. And so I stepped in. I saw my mom take on majority of this care. I saw my sister take this on. I saw the deep silence within our family to just not even talk about this topic because we didn't want to make her feel guilty in any way. It was hard and it was a silent burden that we carried. But what was the worst part about all of this was really the financial devastation associated with it. Is we assume, traditional health insurance is going to take care of everything, the chemotherapy, the care that needs to happen at the home, etc. None of that was really taken care of. And it nearly bankrupted us. But the second piece was the most important one. And the reason why I started Waterlily was because there was no dialogue, there was no language for caregiving and what it took, and how complex it was. There was so much room for just interpretation, especially from our extended family members. And it was the most heartbreaking experience for me for us to navigate all of this, feel the economic pressure, feel the emotional pressure, and take care of her, and being told by external family members who didn't quite understand what was going on, that it wasn't enough. And that if anything, it was, it like a large part of the reason why, she ultimately passed was because we weren't doing the best for her. And it was hard to hear that. And at the same time, not be able to get the help that we were also asking for, both financially and physically. And it wasn't due to any part of just, I would say, blame on our external family members. It was a really more of a blame on the topic itself and how hard it is and how complex it is. And it's easy in high emotional stakes to just point fingers at each other. And so at that point, one is, our extended family members really didn't quite understand, our experience with it. There is a lot of finger pointing, and we haven't spoken to them in over a decade since this event has happened. And to my mom, who came from the Cambodian genocide, where she was incredibly tight-knit with many of those family members and family members that weren't able to make it to this country, to have this event that tore them apart, early on, it was really devastating for me to see this. And that's when I realized that long-term care isn't about being comfortable in retirement. It's about protecting your family members. It's about protecting those relationships and that legacy that we have.
Yeah. So clearly a lot of complexity there and for you to have sort of been on this career trajectory in aerospace and to do this sort of hard pivot. How do you look at that entire experience and all of those interactions and all of those learnings? And when you come out of that and think about what is the problem to solve, right? Like, how do you separate the symptoms from the problem? And how did you really isolate where you wanted to go with Waterlily?
So to start off with, I didn't immediately think, after we went through that experience, I'm going to go build Waterlily. To be honest, I was quite young and I was still building my confidence as, what was the level of impact I wanted to have on the world. I wanted to help out any other founder, in the healthcare and space and fix that inequity. And so when I pivoted my career from aerospace into the healthcare industry, I developed my background in genetics and AI, since I knew that was the future of big data, building out data science like algorithms as a way to understand, what our future healthcare trajectory is going to look like, and help, build the world of more preventative medicine to have better health outcomes. Now, with that came deep experience with what it took to actually build a company, what it took to build an incredible product, what it took to build an incredible team, and what it looked like to build a for-profit company, a sustainable business model as well. And that's when I realized, a couple years into doing that I thought someone would solve for this problem. And it was unfortunate for me to see that no one had yet. And so that's where I developed the courage actually to build out Waterlily. And first, instead of trying to build off of only my experience, I interviewed hundreds of other family members. And I wanted to understand what was the core DNA of devastation that was experienced on this topic that we wanted to get rid of. That was a core problem we wanted to solve. And what we decided is that, the only way that you can really make outsized impact on someone's financial trajectory and the family relationships was to talk about it ahead of time, before it was happening, before we were in the thick of it. And so that is what was born out of Waterlily's initial discussions was, is it possible for us to motivate young enough family members to think about this topic, to build out that care plan so that they could actually afford a much better quality of life when they need it, when they age? And so from there, we started iterating very quickly in this industry to continue to learn from others what it took to get those young enough family members to do it. And at its core, I don't like building AI for the sake of building AI, but that was a beautiful use case where if there's any way that we can help motivate these family members by showing them their unique story of how they're going to age, what that's going to cost, how that's going to affect their family members, could showing them what that scar tissue would look like help motivate them to build a path that would go around that scar tissue they otherwise would have developed on this topic.
Yeah. So what are some of the conversations that you're hoping come out of people's experiences with Waterlily? Like you talked about sort of the end, the data that comes out of that process. So what do you hope people talk about that maybe you didn't talk about with your family that resulted in your experience?
Absolutely. Yeah. So at its core, there are 3 main things we want to come out of the system, or at least that's what I wanted. And I'll give you a fun tidbit of like what ended up coming out of it as well, because what you build is not always what you get. The first piece is I recognize that the one of the largest factors that drive better quality life or worse quality life is even having the financial means. And long-term care is so exceptionally expensive. And I saw that early on, but I thought about, well, there's also healthcare inflation. So it's going to be even more expensive. And what are people doing on it? Nothing. And so that was actually a really important piece is how can you understand what that future cost is going to look like? But how can you understand and get access to investment tools and financial tools that can help you understand if you make financial decisions today, smart ones, you're good. You're going to be on track. You're going to be fine to get the quality of life that you're looking for. The second piece is the family protection aspect, like getting that legacy that you always wanted for your household. And so what we built out was also predicting not only just how expensive it was going to be, but how much of those care hours were going to be taken on by family members. And we wanted a conversation around, well, did that make sense for the children? Did that make sense for my spouse to take this on? And we're now seeing much more realistic conversations around, well, actually, if Jane and her husband, John, were going to need care around the same time, you probably can't rely on John to take on all that care and just, hand wave it away and just say like, oh, she's going to take care of me. She's always taken care of me, or my kids will take care of me. But now they realize, wait, that many hours, 500 hours, 1,000 hours, a part-time job, they don't have the time for a part-time job. So when you give them concrete numbers, they have that conversation then and there. And the third piece is educating them on what long-term care actually means and helping them build out that care plan, because it's not just about having the financial means and also, learning if the family members want to step in, but also where do you want to age? If you want to age at the home, that has massive outsized impact on financially what this is going to mean for you. Can you actually afford it, et cetera? So,
when you think about how Waterlily uses generative AI models to predict long-term care needs, it's constantly learning. I'm sure you probably see some early trends emerging from that data. So anything that you can share that's coming out maybe generationally, any differences that you're seeing in how people plan between generations?
I love the play on words. There's like generative AI and then the generations.
Unintentional. Yeah.
First, I'll share that we do use both a combination of traditional predictive ensemble models as well as generative AI. The generative AI piece is not being used for our actual predictions of what's your likelihood of needing care, what age, how long, because we actually need to run validation and testing to see how accurate were we on that. And you can't really do that with generative AI because it can hallucinate and it's really hard to catch when it hallucinates. But we do use generative AI when it comes to understanding the documents that get uploaded into our system, being able to pull out key terms, and then using additional post-processing to see, well, do you even know what you're planning to purchase or what you already purchased? And then we can pull out the terms and then, run some core basic math on top of that. And so there are really interesting, I would say, trends on us being able to use this data and the fact that it gets adopted by certain generations that I think would not have been possible before. So for example, if we launch this tool, for example, in the silent generation era, I think that it would not have gotten adopted at all. It was a generation where you mostly focused on having person-to-person conversations, and that's how you got educated. Now with the baby boomers being that first, the oldest generation to actually use technology, they're starting to be aware of, wow, AI is actually useful. It's in everything that I kind of do, whether it is on my iPad or my iPhone. And so that's been really exciting because they're also the generation that needs a massive amount of help. They're that wave that is occurring. And so we do see adoption there, which makes us so excited because it's never too late to build out a plan. But where we are going to see outside's impact and outside's adoption is going to be with the Gen Xers and the millennials, and especially the Gen Zs and alphas. It's only going to become more integrated into their daily life. And that's going to be really important because at its core, long-term care is exceptionally hard to predict, what that risk is going to look like. And so the more that it could be, the more that we could gather data as a part of your day-to-day life and help you make smarter decisions, or even tell you, oh, that risk is changing in some way. What can we do about it? The more sustainable it is for us to age.
Yeah. What about as far as caregiving experiences? Because as part of the tool, people sort of say where they might like to age, what type of care they might like to receive. Are you seeing any trends there?
On the care,
and what people choose, yeah.
The answer is people are actually choosing now before it just happens. And it's pretty insane to verbally say out loud that they're actually now choosing, because when they aged before, it was a matter of like, mom fell down, she broke her hip, she went to the hospital. Now she's in a sniff. Maybe we could take her back home, but the home isn't even retrofitted to be safe. But they don't want to take him to assisted living because that's really expensive. And so we have that same kind of, financial devastation and family relationship devastation that, existed before. But with Waterlily as a system, people are now seeing that piece of, oh, I'm going to have 1 to 2 ADL needs. I'm going to need help maybe with getting in and out of bed or taking a shower. If I need help with those 2 things, do I want to be at the home? Well, I think I want to be at the home. And if they click on, I want to be at the home, we show you, oh, that has a financial, decision associated with it. Or you want to go into independently the needs appropriate facility here. And they realize, oh, that also has a financial, piece associated with it. And we notice that they're taking into account, can I financially afford this as they're making these decisions? So they're not only proactively deciding I want to age at the home, but now they're having a deeper conversation. Oh, is my home even retrofitted appropriately? Or I want to go into assisted living. Well, what's going to happen to my home as a result? So they're having those proactive conversations with their kids. They're thinking about their legacy. And we're seeing now an end-to-end preference, filled out, not just, oh, I don't want to go into the nursing home, which is what it was before. But now it's like, I want to go into a nursing home. I think I'm open to going into a continuous care retirement community, or I want to stay at home for as long as possible. But if I have really serious needs, then I want to go into a nursing home. And now it's so much clearer, not only for them, and I see that peace of mind on their face, but also for their kids as well.
Yeah. So along the line with their kids, or, whoever they think in their family might be able to fill in some of those care need hours. Are you seeing any trends with whether they want people to take care of them versus outsource their care? Is that a trend or anything where you're seeing a trend?
Yeah. That's a fantastic question. And we are seeing a trend where people are changing what the care plan looks like from the reactive version that we show to them. So, and 2/3 of the individuals that end up self-reporting at the end of filling out a care plan, what they ended up doing with that, 2/3 end up sharing that I changed how I want my family members to step in for that care, which is a massive amount of people that are opting into, I want a different trajectory than what I had before. And I had a sense that would happen. But the thing is, because it was so frustrating for me to hear something that just logistically didn't make sense. Oh, my wife's going to take care of me. And they are like 200 pounds and she's like 100 pounds. Or they say like, oh, my kids are going to take care of me, but you're halfway across the country. But it's so easy to just say that like my family's always going to be there for me, because you're close, but like logistically it doesn't make sense. So I'm like, it was one of the hardest algorithms we've ever had to build out, which is this predicting how much would your family members step in for you, whether it's your spouse, your children, or other family members compared to professionals, because it's going to affect costs. But also 2 is this is a reactive version of yourself. You have a chance to change that. And 2/3, and I believe that there's even more individuals than the 2/3 that actually like not only say that they're going to change it, but they actually go and change it in our system. And they say, if they have the means, I don't want my kids to step in. They actually zero out their children hours. When they also notice, well, my spouse, she can't really take on 10 hours physically of taking care of me. And they actually zero that out as well. And that's when it forces them to make smarter financial decisions as a result.
Yeah, that's really interesting. So several of the conversations that we've had on this podcast focus on a lot of these similar themes, right? The importance of having a plan, the importance of telling other people what that plan is, and, having an opinion on the type of care and who you want to deliver it. I know as part of your experience in Waterlily, there is, you sort of fill out your medical history and things like that. So when you think about some of the factors that drive the biggest shifts in what you'll need from a care type, duration, intensity, all of those, what are some of those factors that are the big movers, and thoughts on how our listeners can manage some of those?
Mm-hmm. Fantastic question. I will share, if I had all of a consumer's patience in the world, I want to ask him 3 times more questions than we are actually asking them. Because in the intake survey, we ask about 50 questions that are logic gated. So if you don't actually have a family, we're not going to ask about how many we're not going to ask about fit siblings or children or whatever else. And so we already narrowed down to the highest predictive variables that we could possibly find. And of course, it's not a shocker. It sits in social demographic information, financial information, and medical information, and other health information, such as your mental health, for example. Now, with that, it's also a shocker to other individuals when they say like, oh, well, in this era of preventative medicine, I've been eating healthy, I've been working out all the time, and I don't even take prescription medications. So that means I'm never going to have a long-term care event. And what we see with our data instead is that if you're actually healthy and you're healthy for a really long time, both mentally and physically, you're going to bypass a lot of those early mortality events, and you have actually higher likelihood, like your long-term care event on average is, I'm going to say on average, we do personalized predictions, but I'm just going to give broad patterns here that don't make sense to the average consumer. You're more likely to go through a cognitive decline event. And so we see on average that your long-term care event is going to be longer than someone that is physically unhealthy, but mentally healthy. And then for someone that is both physically healthy and physically unhealthy and mentally unhealthy on average, we also see that you have a longer, more expensive event as well, generally speaking. And so those are some not so obvious pieces. I'm so excited to, if once we have the time to really dive into those segments of data across, let's just say zip code, like women that live in San Francisco, for example, are going to be different from women that live in Wisconsin. And so as a result, there's probably going to be personalized, not advice, but there's going to be personalized, kind of insights backed by, where they're at, what their family structure looks like, whatever else. We can do that today. And if anything, we have some pilots where they're trying to do that today. So not painting in broad strokes, I'm only saying it just because it's incredibly unintuitive, what you could be doing and what that means in terms of whether or not you have a long-term care event, how expensive is it going to be, how long it's going to be.
Great. So when you think about all the conversations that you are trying to facilitate, through the Waterlily tool or just, through your own experience, what are some of the aspects that we're still missing, right? Like if you were going to think about your own personal experience, and I know you've built that a lot into the experience that you're building for Waterlily, what are those edges that still kind of get missed that can make a huge impact on, that really clear communication and expectation setting when it comes to long-term care plans?
Mm-hmm. Yeah. I love that question because what I see with a lot of both financial professionals and what I would just say, I'll kind of break it up into two. There's financial professionals and care professionals that have a lot of this conversation. With a lot of the financial professionals, honestly, it's just because these are the tools that they grew up with, that they're used to, is national averages, and just saying, well, if you're going to need about, let's just say you're a female, you're going to need about 3.5 years of care. Let's look into a nursing home in your area. Let's multiply that. Do you have that much to self-fund? There's a lot of things wrong with that sort of conversation that we fix within, Waterlily, which is one is it's not just nursing home level, costs. When most people think of long-term care, they think, oh, it's just nursing home level costs. That's not true. There's a hidden a significant amount of cost that comes from before you have nursing home level care, actually, that really devastates your family, devastates your finances ahead of time. So recognizing that there's more than just nursing home level care, there's also assisted living, there are retirement communities, there's aging at the home, and what does it take to get, resources done there? The second piece is inflation. they seem to keep forgetting they say like, oh, in today's dollars, let's just say nursing home is $10,000. We'll multiply that. Do you have $350,000 to self-fund or not? And someone says, of course, I have $200,000 today. Of course, by the time I retire in 20 years now, I'll have $350,000. It's like, no, in today's dollars, it's $350,000, but then you have to account for healthcare inflation, which is currently more than double, from CMS's actuarial tables, more than double the inflation, rates itself. I could go much deeper into the fact that we have massive financial, the financial gap is widening as we go into younger and younger, generations, and why it's more important now than ever to account for that inflation piece, make smarter financial decisions. But those are two pretty large things that we see, financial professionals get wrong. And when it comes to care professionals, they just focus on, who do you want to, what is your care plan? Who do you want to take care of you? Or do you have a power of attorney? And so they really dive into bits and pieces here and there, where of course for the client, they're like, I don't know why this is important to me. You're telling me broadly, it'll help reduce hospitalizations broadly. It'll help reduce, burnout. I don't even know what you're saying. I don't really understand, what you mean, because they're missing the financial picture of it. So I think these two worlds need to really blend and go hand in hand.
So just to bring things home for our listeners, if you had to think of maybe 3 questions that you think it's really important to either ask yourself as you're thinking about your own care plan, or if you are embarking on your own caregiving journey with a loved one, what are 3 questions to sort of get the ball rolling, and having those, to get all of the information and desires and wants and needs out onto the table?
Absolutely. I think the first piece at its core is the financial piece. The first one is, can you get for someone, let's just say, I'll make it a bit concrete because majority of the listeners, majority of caregivers are in their 40s to 60s. The easy question is, well, by the time you retire, do you have low 7-figure, digit budget for just a random thing to happen to you and you're going to be just fine? If you don't, which vast majority of us don't, then that's where you should start to look into financial vehicles, particularly for this topic, because that is one, a very likely event to happen, but also that is what the cost is going to look like for you if it were to happen. If you don't consider insurance, if you don't consider, looking into certain care facilities where it could also act a little bit like insurance. So there's high leverage vehicles that you should look into today that you could start to invest in, not not trying to recommend financial advice or anything else, but start to educate yourself on, if you can't financially afford that, think about what would it take to actually financially afford that. And then 2, naturally what's associated with it is, what are your preferences? How do you want to age? How long do you want to age at home? Is there a certain point in which you can't cook anymore, that you want to go into a community? But those are really insightful, answers that you could start to give to your family members, especially in an event of cognitive decline, that you no longer remember what to do in this particular case. And the third piece is within that plan, discussing it with your family members, because you might realize in that conversation who you could really rely on for financial decisions and who could take on those care decisions for you if you cannot take them on yourselves. And 2 is you're also going to learn their capacity, what can they actually help you out with? And maybe you need to save more financially than you expected to make sure you get that quality of life that you're looking for.
Great. Thank you so much. Very actionable advice, and may not make the conversation any less uncomfortable, but I think, having a guide and knowing that these are the things that really matter and can make that experience as good as possible for all involved is important. But thank you for joining us today, Lily. I appreciate it. Thank you for your perspectives and for, pushing on and innovating in the long-term care space with Waterlily.
Thank you for having me.
That's it for today. Thank you for joining the There for Care podcast by CareScout. Be sure to like and subscribe and share with your friends that are going through the caregiving journey.